Well, let's get more now on the report into the failings in the case of Valdo Calocane, which identified multiple issues with his mental health provision before he went on to kill 3 people in Nottingham last summer. The Health Secretary, Wes Streeting, has been giving his response to that report.
What the Care Quality Commission have uncovered is deeply distressing, most of all for the families of Grace, Barnaby and Ian, who, in addition to having to deal with the unbearable and unimaginable grief they're going through, are doing so in the knowledge that this could have been prevented and should have been prevented, that there wasn't a single point of failure, but multiple and fundamental failures on the part of the NHS to manage Valdo Calocane's treatment in a way that not only kept him safe, but most importantly kept others safe. That's why, in advance of the publication of this report, the Nottinghamshire Trust have already been acting to implement some of its findings and act on its recommendations, particularly in terms of the supervision of patients, medication and, crucially, discharge. And I've also ensured that what we've seen in the case of Nottinghamshire results in action right across the country. NHS has already instructed trusts not to discharge patients who don't attend, which is what happened tragically in Valdo Calocane's case. And there will be further action, and I'll be seeking regular updates, because we've heard so many times before lessons must be learned. Actually, what we need to see is lessons acted upon, not just for the benefit of people in Nottinghamshire, but right across the country.
Can I ask you, there were so many red flags, so many warnings. What part of it was the worst? Was it the fact that Calocane didn't attend his regular sessions with the clinicians, the fact he wasn't taking medicine? What for you was the biggest red flag that should have been acted on?
I think what's so shocking about the Care Quality Commission's report is that there were so many failures and fundamental failures in terms of the supervision of Valdo Calocane, the provision of medication and what happened when he wasn't taking his medication, and then shockingly the fact he was discharged for not attending when actually non-attendance should have provoked closer supervision. And the tragedy is, and I can't imagine, even having met the families on a number of occasions now, I can't imagine the unbearable grief they are going through, let alone to contemplate going through that grief, knowing that these deaths were preventable if the NHS had been there when it should have been. And that's why it's important to me that Nottinghamshire is already acting ahead of the publication of this report to make changes, but also that the NHS is acting nationally to make sure that things like discharge can't happen in that kind of way, to make sure that medication is supervised and to make sure that people who could be risked themselves or others are properly supervised and managed. Had that happen, Grace, Barnaby and Ian might still be alive. And that is the hard truth that the country has to face up to and those poor families are having to grieve through.
The families have said that the government has told them there will be a statutory public inquiry. Is that correct? Will there be a statutory public inquiry?
There were so many failures that the families of the victims have had to suffer since these appalling homicides. And that's why the Prime Minister, before the general election, committed to a judge-led inquiry looking at failures not just in the NHS, but throughout the criminal justice system as well. Because what I've been really mindful of every time I've met the families is that their ordeal and the pain that's been inflicted on them continued after the deaths of their loved ones. And that's because of failings and a lack of accountability, not just in the NHS, but across the criminal justice system. And that's why the Prime Minister is now actively considering how that judge-led inquiry can best operate to deliver the answers and the accountability that the families are looking for.
OK, so just to be sure, there might be a public inquiry. That hasn't been confirmed, is that correct?
A
statutory public inquiry.
The Prime Minister committed before the general election to a judge-led inquiry. He is now actively considering, with the Attorney General and colleagues across government, how best to set up that inquiry in a way that delivers both the accountability and the answers that the families are looking for.
OK, only a couple of more questions. Look, the families obviously distressed. They say the NHS has blood on its hands. Do you agree with that description? And what they want to know is, why are these NHS managers still in post?
Well, look, the hard truth here, which is, I think, hard for the whole country to hear, let alone me, is that had the NHS done its job, had there not been multiple fundamental failures, 3 innocent people might still be alive. And what the families of Grace and Barnaby and Ian are going through is grief in that knowledge. And that's why I totally understand why they've accused the NHS of having blood on its hands. I think it's a hard criticism to hear, but one the NHS has to take on the chin. And most importantly, we need to ensure 2 things. Firstly, that there is accountability. And secondly, to make sure that the factors that led to the preventable deaths of 3 innocent people are eliminated as risk factors right across the country. I'm reassured that Nottinghamshire Trust is already acting. I'm reassured that the NHS nationally is also acting, and I will hold them to account by demanding regular progress reports so that we don't have the usual mantra of lessons must be learned. We instead have the reassurance of action is and will be taken to make sure that other families don't have to go through the unbearable grief that these families are going through today.
You've already said the CQC is not fit for purpose. Are they the right body to be investigating this?
Look, we've seen very clearly from the Penny Dash review into the Care Quality Commission, which is still undergoing, that the CQC has failed as a regulator, as an inspector, and those failures are fundamental and the organisation is in need of reform. The reassurance I was able to give the Nottingham families and the reassurance I was able to give to myself and can give to the public is that in this case, with this report, the CQC has done a thorough job, and that is consistent with what Dr. Dash told us, which is despite the overall failings of the CQC, which are damning in themselves, there are some great people still doing high quality work in the CQC, and I very much see this report in that context.
Okay, my last question. We know, and you say this all the time, the NHS is broken, but particularly within the NHS, the mental health service is in crisis. It's been in crisis for years. There are too many patients, not enough staff, not enough beds, and patients aren't being seen and diagnosed and treated on time. How can you fix the mental health service in this country to make sure that tragedies like this don't happen again and that people who are sick get their help in a timely manner? It's a huge undertaking. We're talking about the entire mental health service. How do you convince people in the country that this is going to happen at speed? Where does the money come from? How do you even begin to do this work?
The really hard truth that we are confronting today is that when we say the NHS is broken, it has life and death consequences. And for 3 grieving families, we are seeing the consequences of what happens when mental health services don't do what they are legally required to do in terms of supervision of patients, provision of medicine, and closer supervision of those who might be at risk of harming themselves or other people. And that's why I'm not ever going to duck the scale of the challenge or the reality that we face today and we inherited at the election. And we are going to take action right across the board, but particularly in mental health, whether that's recruiting 8,500 more mental health staff to help cut the waiting list, doing more at the prevention end by putting mental health support in every primary and secondary school in the country and walk-in hubs in every community, and reforming the Mental Health Act in a way that gets the balance right between recognising there are people whose liberties are being deprived today who could live safely in the community, but also recognising for others there needs to be much better and closer supervision so that people like Valdo Calocane are not able to be on the streets causing risk or indeed fatalities to others. And that's the balance I'm determined to get right with Mental Health Act reform, which was in Labour's first King's Speech.